I want to thank you so much for taking the time to, really explain things that I think in a way that layman's like myself can understand. But I want to ask you, with all the concerns we see with some doctors and even scientists almost getting punished for speaking out against the politically correct narrative when it comes to the are you at all concerned about yourself getting any backlash, and what makes you willing to speak out about this?
Yeah, no.
I'm here with Dr. Stephen Pelech and a beautiful art collection, but that's not what this report is about. It's about something very important that the public should hear about. You've initiated a petition that I think is a matter of public interest. And we're going to link that, but we're also going to get your credentials so people know who you are and how it pertains to what we're about to talk about.
Sure. No, I'm a professor in the Department of Medicine at the University of British Columbia. I've been on faculty for about 33 years. I'm also the president and founder of Connexus Bioinformatics Corporation in Vancouver. We've been actually specializing on doing research for about 2,000 labs around the world in 35 countries, looking at development of markers for cancer, neurological disorders, and diabetes. But more recently, we've been working also on the COVID-19 problem with development of tests to determine whether or not a person has actually been infected with SARS-CoV-2. And we've been testing drugs for their ability to inhibit the replication of the virus. And finally, I'm also involved in the Canadian COVID Care Alliance as the chair of the Scientific and Medical Advisory Committee. I'm actually the vice president and one of the founders of the Canadian COVID Care Alliance. So I'm pretty well in tune to what's happening in the COVID-19 space.
And so today in this report, you're going to want to watch it in full because we're going to discuss some concerns that you have and have brought forward about pregnant women and childbearing aged women getting as well as children. So you're going to want to watch this in full for informed consent. The other thing is, if you're watching this on YouTube, despite how credentialed you are, information like this is highly censored, which means we're going to sign off from this platform right now. And in order for you to watch the full uncensored report, you're going to have to click on the description box below and click on the link there, and that will take you to the full uncensored report at rebelnews.com. And you'll also find the link to the petition, which I think is going to close in a few days, right?
That's right. Yeah, we actually decided to do it for only 30 days because we want to make sure that this gets into Parliament for discussion as soon as possible.
Right. All right. I'm Drea Humphrey. This is Dr. Stephen Pelech, and we'll see you when you get there.